Okay.
So, Dr. Nisar, I'm wondering when you refer to the Yoga Sutras, Patanjali only mentions asana in three sutras, and it's more in reference to the meditation posture with ease. And so when I look at Western yoga and what's become of it, obviously the Hatha Yoga Pradipika mentioned more asanas, 30 some asanas. But now in the West, we have this focus on fitness with Hatha Yoga and so many hundreds of asanas. So where do we refer to as yoga therapists for
Yeah.
the postures?
Okay. So, though Patanjali mentioned only three sutras about asanas, he has indicated to thousands of postures or millions of postures. Uh, Patanjali doesn't care what posture you are taking.
Mhm.
His intention or his concern is that whatever posture you have taken, that posture should be, you should be stable with that posture and it should be comfortable for you. In second sutra, Patanjali explained that you should not be in a position to call it as a asana where you have to take lots of efforts. So it should be effortless. And another thing that Patanjali has talked about asana, Ananta Samapattimta, that you should be able to merge in with that posture. These are the basic fundamentals of Patanjali's asana. So innumerable, I mean, you can make thousands of asanas out of Patanjali's those two sutras. Third sutra is the Falashruti, that means the benefits of asana, what he has taken as Tatododvara Vighata. Now let's come to the second part of your question, Hatha Yoga. Hatha Yoga has given 30 plus, 36, 38, 30 plus asanas. Now, if you read Hatha Pradipika, it is very clearly mentioned that the purpose of Hatha Yoga is just like a ladder to Raj Yoga. Raj Yoga, which is popularly, or most of the commentators have said that Patanjali Yoga Sutra is Raj Yoga. But Raj Yoga is basically the higher form of yoga. So the design of Hatha Pratipika is in such a way, or Hatha Yoga in such a way, that it works as a ladder to reach to the higher goal of yoga. And of course, the elaboration of Patanjali Sutra about asanas you can find in Hatha Pratipika or in Hatha Yoga. Now, coming to the third part of your question, that in modern time or in Western world, not even in Western world, in India also, the asanas are taken mostly like a physical, only physical form of asanas is used. You're stretching yourself and you are doing namaskar mudra, and that is called asana. And it is mostly taken towards the physical fitness. So it is a part of gym nowadays, the asana class. Looking at whole of the situation, if we see them from the little broader perspective, the problem is that when time progressed, the understanding, the benefit of asana or understanding of asana as such, that got little diluted. Asanas are not merely physical postures. Asanas have a huge contribution to develop your psyche, and that's how that asana should be practiced. Now what had happened with yoga, and now it is happening with Ayurveda, that we are trying to prove the Indian science, we are trying to prove this ancient science based on modern parameters, just to seek affiliation from the Western world, just to please Western world, or just to make it accepted by Western world. And it started almost 5 6 decades back, which is, I feel, unnecessary. The Indian sciences should be first, they should be tested based on the scientific parameters, Indian scientific parameters. If you start understanding asanas in Hatha yogic way, or in Patanjali way, you will find that if you apply Indian scientific principles, you can get much bigger view out of it. For example, Patanjali says that if you practice asanas in this way, you will get tato dvandva nabhighata. What is dvandva? Dvandva is duality. Now, what is duality? It can be defined in different ways. I personally take duality as the frustration, the confusion that I have, the imbalance I have in my life. So I should be able to practice asanas. If I practice them in a way that Patanjali expected, I will be able to get rid of that frustration, that depression, that confusion, that imbalance. I will be able to get rid of it. Even if you take Hatha yogic principles, and if you see what is explained as a falashruti, as a benefit of asanas, which has got amazing claims that is made by Hatha Yoga. If we try to understand the asanas from Hatha Yogic science point of view, you can get better understanding of asanas. So, uh, first thing that we should stop seeking approval, or we should stop accepting, stop seeking the acceptance from the modern science. Modern science is relatively new. Of course, they are too much advanced. They have really fascinating labs, and it is very much objective, and all these things there. But what we have lost as Indian sciences, we should regain them. Unless and until we don't regain our own science, we cannot see the broader aspect. Patanjali had that broader vision in a big way. That's why he needed only three sutras to explain asanas. Maybe in 10th century, after thousands of years of Patanjali, we lost our science. So maybe Hatha Yoga required 40 or 50 sutras, and now we have lost it. So we are needing thousands of asanas and the postures with Namaskar Mudra. So this is not how asana should be looked upon. Asana is basically somato psychic effect. So whatever your psyche affects your body, we call it as a psychosomatic. But whatever your body affects your mind, it is somatopsychic. Just like we were discussing about warrior pose. If you want to gain the strength of the warrior, you should do it in a warrior pose and tell yourself, feed yourself, go to your conscious, send that message through your actions to be strong. If you want to get rid of fear, the same warrior pose can be used, you know. So, asanas should be tested upon the Indian scientific point of view. That's very important. For example, halasana. Now, why do you advise someone halasana? You ask, like, as a yoga therapist, how should you look at how should you look at asana? That's what you asked, right? Now, as a yoga therapist, my first question is, what is your criteria behind prescribing any asana? Do you really prescribe any asana to people? You're giving a set, and what are your criteria for choosing the asana? How your muscle bends, how your joint get affected, how your organs are twisted. What do you have more to select the asana for that particular person? For selecting halasana, what is your thought process behind it? Why did you choose that particular asana for that patient? Unless and until you don't get the answer, you cannot call yourself yoga therapist. Okay. For example, halasana. Can halasana used for the genetic problems? The question should be asked. Setu bandhasana. What is the significance of Setu Bandh? What is Setu Bandh? Unless and until you don't go deep into this science from the real point of view, you cannot use these tools. I mean, if you have a very sharp knife or sharp sword, and you are using that sword just to cut the onions while you are on the battlefield, the sword can be used to fight your enemies, and you are just eating the onions itself. That doesn't make any sense. In modern yoga therapy, in current practices, what you are doing is the same. The example is very wrong. I shouldn't be giving such examples. But what I feel that this asanas, pranayam, mudra, bandha, right from yama niyama to dhyana, all these uh, tools, the yogic tools that are given to us, they can be used in much better way if we understand how to use them properly. Like yesterday, I was talking to Dr. Tushar, and we had nice discussion about how do you prescribe Kapalbhati. Now, when you go to the class, they ask you to do Kapalbhati 60 strokes 3 times. In some of the traditions, people do Kapalbhati for half an hour, 1,000 strokes, 2,000 strokes. What is the criteria? How do I know how much Kapalbhati I should do? As a yoga therapist, you should tell me that Nisar, you should be doing 120 strokes. But what is the thought process behind giving me 120 strokes? What will be the no, quantity of Kapalbhati for me? Will that quantity be the same for other person who is lean and thin? So, what are the criterias when you call yourself as a yoga therapist? You should have some base for that, some reasoning for that, some logic for that. It should be that logic, that rationale should be from the Indian science, because modern science has got different parameters. What you people are used to see, everything you want in black and white. Ayurvedic sciences are experiential science. These are not experimental sciences. Everything cannot be in black and white. We'll have to develop that. But development of that system, development of that research also should be based on the principles of Indian sciences. We cannot surrender, or we cannot depend, we cannot rely on the modern parameters, right? I really appreciate, I really appreciate my fellow yoga people doing modern research. It's really wonderful. It's amazing. You are able to find what changes in your brain are happening because of the pranayam. Amazing. How your blood is getting affected because of pranayam and because of Shuddhi Kriya, it is amazing. But have we ever digged in our own science? It is such a rich science. It has given everything. So, be it asana or be it any other yogic practice, what is required to go deeper in our own science? And that's what we are trying with holistic yoga therapy. I hope that answers your question.
Yes, thank you.
Okay, thank you.